One of the most modern laboratories in Hungary operates here in Debrecen. The Clinical Center for Cell Therapy was founded in May 2003 as the fruit of cooperation between the Omninvest Ltd. And the Medical and Health Science Center of the University of Debrecen. The Center for Cell Therapy has achieved outstanding results with stem cell therapy treatments. In our film, the most renowned researchers and professors speak about the results of the center. 2 completely recovered patients who were given up by their doctors also talk about their experiences. The different cell therapeutical products are developed and manufactured in the laboratory of Omninvest Ltd., which was set up especially for this purpose. Sterility in the cell therapy laboratory is provided by positive pressure isolators.
The operation of this laboratory is in compliance with GMP guidelines, which means we are able to manufacture the cells that the patients get back during therapy in pharmaceutical quality.
At the laboratory, the technicians process the blood or bone marrow according to 2 methods. The starting material of the therapeutic products is leukapheretized blood, bone marrow, or umbilical cord blood.
By centrifugation, we separate the cellular ingredients to 3 fractions: red and white blood cells and plasma. Then we fill the cellular fraction-rich in white cells into a freezing bag and add cryoprotectant liquid, which helps to protect the structure of compounds.
The other method is called magnetic cell sorting. This is carried out in a totally closed system with the addition of GMP-classified reagents.
There is a marker on the surface of the stem cells, the CD34 positive marker. Purified mouse-derived antibodies are bound to these markers, and then the iron-dextrin complex is attached to the antibodies, which can be retained in magnetic field. The unmarked cells flow through the cell separation column, while the marked cells stay on it. After seizing the magnetic field, these CD34 positive cells can be collected, processed, and formulated according to clinical application, and then the patients can get them back.
Cells are frozen in controlled steps with the help of liquid nitrogen. Storage is at a -196 degrees Celsius.
We store the cells at -196 degrees Celsius in liquid nitrogen containers. We start freezing the cells from room temperature to -90 degrees Celsius with the help of a controlled rate freezer. It makes sure that the freezing process takes place at an appropriate rate.
The CD34 positive stem cell rich suspension can also be manufactured from umbilical cord blood at the laboratory. After birth, obstetricians collect the blood from the umbilical cord. This is processed at the laboratory and can be used later if necessary for cell therapy treatments.
The collection of umbilical cord blood is an important issue for the obstetricians. This provides an opportunity for families, public banks and the doctors to use the stem cells for therapeutical purposes at the Medical and Health Science Center of Debrecen.
Patients suffering from autoimmune diseases are treated by stem cell therapy only at Debrecen in Hungary. The leader of the department is Professor Margit Zeher. These treatments started 3 years ago. All over the world, this was the first time when patients were treated with their own stem cells.
12 patients have undergone stem cell transplantation so far, and all of them were technically successful. They improved a lot, and we have just collected the stem cells of our first multiple sclerosis patient.
In case of autoimmune diseases, stem cell therapy is used where traditional medicine treatment cannot bring successful results.
After a certain special treatment, we harvest the stem cells with a special instrument. Then minimum 6 weeks have to pass. During this time, Omninvest stores the stem cells and prepares them for transplantation. Then the patient is placed in a sterile ward and we destroy his immune system as much as we can. Next, the patient's own stem cells are given back, and usually around day 7 or 8, they start homing and the production of white cells begin.
One of the recovered patients is Mrs. László Vince. She had arthritis starting from 1999. Her stem cells were harvested and frozen in 2006. She spent 25 days in a special single-bed sterile ward. Some months later, her immune system was completely strong again.
I can thank stem cell therapy for my 100% health. I am in the same good condition as 15 years ago.
She might be sitting in a wheelchair by now with bleak prospects, but her quality of life would be certainly poor.
I salute medicine and I am extremely grateful as they help me to be healthy again.
The Omninvest Stem Cell Laboratory, together with the Department of Internal Medicine, has excellent results on the treatments of patients suffering from peripheral arterial diseases. The treatment started in 2006. So far, 7 patients have received 10 stem cell therapies. The results exceeded our expectations, said Professor Zoltán, the leader of clinical trials.
The stem cell laboratory produces stem cell suspension from this harvested bone marrow by the afternoon. This is just only one 10 milliliter ampoule, and it is injected intramuscularly into the patient to 15-20 places, and then we are just waiting for a miracle to happen. So far, in the case of our 7 patients, there were some extremely severe cases with several amputations where the patient could hardly walk just a couple of meters. And take a look at him now. Some months after the stem cell therapy, he is perfectly healed. Now, patients can walk several hundred meters. There are some who walk several kilometers now. For example, there is this patient. Every vascular surgery center wanted to amputate his toes. It is clearly visible that just some months after the stem cell therapy, the patient is healed, can walk kilometers. We have several patients who could go back to work. Probably this is the very first time when we can tell how long the autologous stem cell therapy is effective. The big question is whether the repeated treatment is effective or not.
One of such patients is Antal Dani. He had been suffering from peripheral arteriosclerosis for 33 years. His condition was so bad that amputation of the leg from knee was considered. He received stem cell therapy first in 2006. The treatment had extremely quick results.
In 1 year, an ulcer that hadn't healed for 15 years got healed. The pain was less and the walking distance increased for roughly 1 kilometer, then the pain ceased. At the age of 61, I finally don't have to face the fear of amputation of my leg.
Every year, approximately 50 patients suffering from lymphoma and myeloma are treated by stem cell therapy in Debrecen. Conservative therapies do not always provide good results in these diseases. During stem cell therapy, the patient's own stem cells are collected first, and then they get a huge dose of chemotherapy.
This dosage of chemotherapy can be only tolerated if the patient gets his own stem cells back in shortly after the treatment, 1 day later. They provide immunity in 10 to 12 days' time.
The stem cell therapy has been used with excellent results in case of heart diseases. Patients receive their own bone marrow-derived stem cells after myocardial infarction. Up to date, 7 patients have undergone stem cell treatments to regenerate cardiac muscles.
The therapy means here that the stem cells can develop into cardiac muscle cells if we place them into the cardiac muscles. If we place enough stem cells into the area, they can rebuild the weak cardiac muscle. Actually, this can be the regeneration of the cardiac muscle pump function. The autologous stem cell therapy had no side effect. We sent the stem cell into the coronary artery that was affected by the infarction. There was enough time, 1 or 2 minutes, so the stem cells could reach the cardiac muscle cells. It was great improvement, significant. Those who received therapy greatly improved. Their complaints decreased or disappeared.
Research indicates that stem cell therapy can be successful in the treatment of stroke patients. The Stem Cell Laboratory and Clinical Center for Cell Therapy are looking for appropriate candidates for treatments. The center received permission for the treatment of 13 patients from the Medical Research Council.
If somebody has a stroke, his nerve cells die in the affected region of the brain. It is assumed that stem cells can play a vital role to decrease the extent of this damage. We believe if we can collect more stem cells from the patient and send them to the affected region, we can help to reduce the tissue damage.
The mission of Omninvest Ltd at the Clinical Center of Cell Therapy is to heal patients with state-of-the-art stem cell products and contribute to the progress of medicine. The experts at Omninvest Ltd work towards the incorporation of these treatments into everyday clinical practices as soon as possible, thus promoting the excellent results of the Medical and Health Science Center University of Debrecen.